Yeah. As I got another rhyme, another rhythm for y'all to listen. I'm never quitting on my mission. I'ma roll with what I'm giving. Got some ambition, this new edition, filling positions. Looking at the void in myself and feeling what's missing. Better watch the way you going, better go in the right direction. In the moment you stressing, but you gon' be counting blessings. And I know that for certain. Keep on working, open curtains, haters swerving, cause they ain't ready for your final version. I'm never gonna give up, give up.
You're listening to the Tom Ficklin Show on WNHH LP 103.5 FM, your home for community radio.
Well, everybody, first of all, I would just like to acknowledge everybody that took the time out to come on the show today. We have an esteemed panel of medical professionals from all over the New Haven area. I have, first of all, a very good friend of mine that I work directly with in these shows. He has been, I think, my savior in a lot of places to help me really understand the focus of why people should get vaccinated. And that's my good friend that we share this time with, and that's Maurice Williams. I also would like to introduce to you this, when I say she is somebody that I've gotten to know, and I know that really cares a lot about what happens in this community. She generates a lot of her time, taking the time out to come door to door if she has to. But she definitely works with Fairhaven medical community right over in the Fairhaven area, but she's all over Connecticut, all over New Haven, and that's Dr. Leslie Sue. And you know what? I have to say, when I got involved in this whole piece, and I took the time out to get to know this young lady as well, when it comes to really helping us formulate a training presentation and allowing her staff and people and fellow colleagues to come along with us to help us to really put out a message to you that's true and factual. And I just want you to know how much we appreciate Dr. Tracy Raven. Hey, girl, throw your hands up. And you know what? You know what? This young man actually comes along with Doc with part of her team. And when I say he's very informational and he comes across to really help you understand the importance of taking care of yourself and making sure we have a better community. And that's Ahmed. Ahmed, I'm going to mess your last name up, and I think it's Logronio. Did I say that right? Logronio?
It's Lograno, but that's okay.
Lograno. I told Tracy I was going to mess that up, and I did. Lograno. I got Ahmed Lograno on the call. And last but not least, outreach and boots on the ground is so important. And I'm so glad that we have people out here in this community that's willing to take the time out to come out and really assist you in getting the messages and information that you need in order to be part of this campaign and part of changing people's lives. This person has been in this community for multiple, I mean, in many different areas, you'll be surprised. But when I look at this person, I look at her as one of the people that I desperately need and glad that I have on my team. This is one of my greatest outreach professionals that we have here over at CARE. Her name is Jackie Phoenix. Hey, Jackie, what's happening? So I throw my hands up to everybody, but I also throw my hands up to Tom Ficklin. He has become a very good friend of mine, a person that has taught me so much. So I'm thankful to Tom and 103.5 WNHH Community Radio for allowing us to come on this call today to share this information with you. The call today is called I Get It, Protecting My Community from the Flu and the Delta Variant. And I wanted to bring this panel together just so you know exactly why it's so important and why we keep pushing so much for people to get vaccinated. It's not to get on your nerves. It's not to sell you something that isn't true. It's to give you something that's going to, first of all, protect you and save your life and save you from just being uncomfortable. All of those that have survived it, that's still here, they were very uncomfortable when they had or they were infected by these viruses. The flu is just as dangerous as COVID. And I don't want anybody to think it any different. They're two respiratory viruses that affect our breathing. And I don't know about you, how many of you like to breathe every day? You wake up, you're breathing correctly. That's a great feeling, right? I like to breathe. So we just want to have a basic conversation with you today. Welcome everybody. If I said your name wrong, please forgive me. I'm practicing, I'll get better next week. But I'm so happy to have you on the call. I'm going to start actually with Leslie. Leslie actually practices she's a pediatrician. Actually, she works with our community with children over in the Fairhaven area, but also throughout Connecticut. She also have a very profound outreach when it comes to coming directly to you. As you can see in her background, you see that beautiful blue, beautiful, we call it a van, but it's actually an RV, where she comes directly to you to provide you not just with COVID vaccines or with flu vaccines, but with other internal medicine services. So I'm going to allow Sarah just to come in and tell us exactly what she does.
Good morning, Bernard, and to everybody here. It's great to see everybody. Some of you I'm meeting for the first time, some I'm seeing again. Hey, Tracy. Yes, the community healthcare van has been a presence in the New Haven community since I believe it was 1993. And it's familiar to some folks for providing targeted, what we call harm reduction services to adults who might not be able to get to the doctor easily for either transportation or inability to make appointments or suffering or experiencing unstable housing. But during the pandemic, I was able to meet and work with the medical director of the community healthcare van, my colleague, Dr. Rick Altice, and kind of work with him to expand the services to include our cherished, the other half of our cherished community in New Haven, and that's the pediatric population, all the way down to babies. So since the beginning of the pandemic, we were focused on providing ways to do postpartum checks for moms and for newborn babies, so they wouldn't have to travel by Ubers or ride-sharing services back and forth from the hospital to the clinic to have newborn weight checks and bilirubin checks and breastfeeding support, and moms to have their blood pressure checked. But since the early days of the pandemic, we've seen a need for our services to actually go beyond just avoiding infection with the virus, but also to provide these services to folks for whom getting to institution or clinic-based medical care is very cumbersome and difficult to do. People need to take time off of work, or they need spouses or partners to take time off of work to drive them, make arrangements for the other children that they care for to be watched by someone else while they get to the clinic. And it's really been just such a joy to see the warm welcome that we've received by the community, and to continue to grow and change and reconceptualize what we're able to do as time goes on. Most recently, we've been able to take on a pediatric nurse practitioner who's going to be able to offer pediatric flu vaccines in the clinic. So bringing it back to today's topic, in the community from the community healthcare van. We're very excited about that. It's not something we were able to do in the past. And we're going to continue to be able to offer COVID vaccines ages 12 and up. And as soon as the vaccine is approved from age 5 and up, we'll be able to do that as well.
Beautiful. And I've been present at a lot of times that they've been out in the community, and I'm gonna tell you, they have a great team of individuals that's out there that look just like you and I, that are concerned about your well-being. That leads me to Dr. Raven. Can you just come in and kind of tell us what you do? First of all, let's start there, and then we'll go from there.
Sure. Thank you so much, Bernard. And again, it's wonderful to be here with everybody on the call today and reaching the audience as well. And I also just have to say, having had a chance to get out and see Leslie and her team at work, I can't say enough positive things about the work of the community healthcare van. They're just doing a tremendous job. I'm based in sort of two places. I take care of patients in the hospital at the St. Raphael's campus of Yale New Haven Hospital, and I also take care of patients at the 150 Sargent Drive site, the Cornell Scott Hill Health site, the adult clinic there. And so myself and Dr. Lograno and the the physicians in training that I work with, we sort of have our hands in a bunch of different places. We have a little bit at Yale at the hospital, a little bit at Cornell Scott in the clinic. And, throughout the pandemic, all of us have been providing services in various ways, but I think one of the things that was so meaningful to us and why I'm on this call today is that when the vaccine started to roll out for folks in the community, we were invited to join colleagues to answer questions at different community management teams around the city when folks would have Zoom meetings. And, some of the residents and I would show up and we would just hear what folks had to say, what questions people had about the COVID vaccine, and just, answer what we could, look up answers to the things that we didn't have on the spot, and then get back to people. And I think, for us, this has been phenomenal to be able to hear what people are thinking about. And try to answer some of those questions and encourage folks to get vaccinated in order to try to stop the spread of Delta variant and COVID. And I think now that we've got flu season coming up, I'm so thrilled to have this opportunity to talk with everybody about both, flu and COVID at the same time.
Thank you, Doc. You know what, Amanda, I have to let you come in and add a little bit more into kind of what you do. She gave us a little bit, but you can add in and give us a little bit more about yourself.
Sure. So I also work closely with Dr. Rabin. I work mostly in the inpatient setting, meaning that I work mostly in the hospital. And so, on top of sort of the experiences that we've had during COVID season in both exposure inpatient and outpatient, I think more recently I've been sort of working a lot more inside the hospital and sort of seeing, patients, kind of after that first big peak of COVID that we had a year and change ago, and kind of just seeing how it's been manifesting. And so I've had a lot of sort of exposure to that. And, what's come from that, which is interesting, along with all the opportunities we've had to talk with the community, is just, having different opportunities to talk to patients about what their understanding of COVID is, what their understanding of the COVID vaccine is, taking care of both people who were vaccinated and were now vaccinated and might have gotten COVID, and helping them to understand. And, it's always helpful to talk to people because you get a sense of just what their belief structure is around these things. And that exposure helps you kind of meet them where they are. And so that's why I'm so grateful about all these opportunities where, we as providers can get invited to these meetings and just hear the community talk about these things, what they understand about these things, and just ask us any questions about these things. And it just helps us understand each other, and helps us make sure that everyone has access to the right information in order to make their own decisions about these things. And I know we've been in this pandemic for almost 2 years now, but I still hold out to believe that most everyone that I've met is a pretty logical thinking human being who's just looking out for their health and what's best for their health and their family's health. And so, guiding them through this, I think, has been one of the more rewarding parts of this experience.
Thank you, Ahmad. That's so important. You said those things. I'd like to come to my very good friend, Maurice Williams. A lot of you may know him already. Yes, he is a survivor, but it's so much more to him than just being a survivor in this community. And I would just like for him to come tell us a little bit more about himself. Come off of mute, my friend. Mute, you muted.
Good morning, everyone. Thanks for the opportunity to be on the call with everyone this morning. Hope we're all having a great day. I am actually a community engagement and dissemination coordinator over at the Yale School of Medicine for a division called ERIC. But just in general, from being a lifelong resident of New Haven, I've stayed active in any opportunities for us to really help progress our community, especially in healthcare. And so I've been involved on many committees with vaccination, from Yale Hospital to working along with Cornell Scott. One of the things that's been said from individuals that's talked already is that the importance of making sure our community gets the proper information. And I think that's the most important part. Everybody does have the freedom to make their own decision, but we want their decisions to be based on medical facts and not myths. And I think the most important thing to keep in mind is when people hear things in reference to medical, especially when we talk about vaccinations and stuff, the sample sizes of these individuals that you hear particular quotes from or stories from. You know, if someone tells you, oh, well, 2 or 3 people, this happened to them, and, that makes them have doubt and fear, that's not a sample size. When we talk about clinical research, which I've been involved with for the last 8 years of my life, there has to be thousands of individuals from multi-races and different backgrounds that these vaccinations are tested on before they become able to be given to the public. So that's where our trust should be in those numbers that don't lie. So when Pfizer and Moderna says they're 94 or 95% efficient, that comes from testing thousands of individuals. And so we have to be really careful about where we get our sources from. So a lot of people are out here putting different things out here, chip in the vaccine. I've heard some of the craziest things. So when Ahmad talked about logic, I actually was in a conversation the other day with Tom. Is there a true thing as logic? Because what happens when people have various freedoms, it sometimes takes away the thought of what would be basic and what would be what we would call common sense. If someone has something that can save your life, the common sense part, once you find out that it's safe and efficient, would be to take it. And people have been taking vaccinations since we were little kids, measles, mumps. So I'm really battling why is this particular vaccination so giving people the doubts and the thoughts that you didn't have when you were a young kid getting vaccinated to go to school, to make sure you didn't get the measles, to make sure you didn't get the mumps. And so over the course of time, we have to understand that the medical profession has grown, and you're able to take a vaccine that has been being worked on in its genetics for probably the last 60 years, and then within 8 months be able to come together and put it to where it be effective for people. So all we're asking for is opportunities like this, is to give our community the opportunity to hear the real facts and know the science and know the medical background behind these types of vaccinations and why they're so effective.
Wow. I do really appreciate that. That's such important information that Mr. Williams has shared with us today. We're going to get as much as we can in the time that we have to get a little deeper into those thoughts. Lastly, but not surely, my friend and co-worker Jackie has been in this community for years, doing the work that she does, and I just would allow her to come in at this time and just share a little bit about herself with you all.
Thank you, Bernard. So yeah, I have been working in my community for a really long time. I worked at Cornell Scott for a long time doing HIV counseling testing and did outreach with that as well. And was the executive director of Life Haven, Women and Children. And I am committed to my community. I'm a lifelong resident of New Haven, and I think New Haven gets a bad rap. And so it's sort of like my mission to work and giving it a good rap, a good reputation and not a bad reputation.
And
but I've been
go ahead, Jackie.
Kind of focusing, I've kind of been focusing on the elderly because when I started going to some of, speaking with some of the elderly and going to some of the elderly housing and finding out that they were, like half of them were willing to get the vaccine and a lot of them were not. It's sort of like really made me, because they're the population, that I really want to focus on, because a lot of them have pre-existing conditions, and I was just concerned that if they didn't get the vaccine, if they didn't have the right information, as Maurice said, that you want to make sure that they have the right information. And Dr. Ahmed said that meeting people where they are. So what I did find was that as I'm talking to them in a group, they're kind of resistant. And I don't know whether it's because other people are there or not, but I started making those little kits with sanitizer and mask, and I would go to them individually. They didn't mind you coming to their apartments and just talking to them individually. And that way I found I was able to get more vaccinated. I actually gave a couple of rides to people, encouraged them to talk to their doctors and get some understanding. I didn't have all the information. So I wanted them to, have conversations with their providers. Some of them I was able to help with questions that they should ask, so that they can get, again, better understanding. So I find that it's a little slower process than I expected, but what I find best for me is working with them one-on-one. They tend to share more. Those who, are not getting vaccinated, they tend to share a little more and let you know what their concerns are. And most of it is just not really knowing and not really understanding. And if you break it down to them, meet them at where they are, and their understanding, they're a little more open. So I'm hoping with the flu shot, it will be a little better. But it's a slower process than I thought, but the elderly are coming out a little more in the homes that I've been working in, getting vaccinated for COVID.
Thank you, Jackie. That just kind of leads us into where we are right now. And I would like to just jump right into it if I can. I'm going to go to Dr. Tracy Raven right now because I just kind of want to get your opinion as it relates to the importance of getting vaccinated, getting the flu vaccine. If you haven't gotten the Delta virus vaccine, why it's so important in your own interpretation, why you feel it's important that people should get vaccinated.
Sure. Thanks so much, Bernard. I think, so the flu vaccine is something that we've been asking folks to get every year, for many, many years. The reason we ask folks to get it every year is because the flu strains that are circulating in the community, the ones that are most likely to make people sick, those change a little from year to year. So every year it's a slightly different vaccine. So we're asking folks to get a new vaccine every year. Some people have said, well, flu didn't seem to be that big a deal last year, so why should we worry about it this year? And I think, one of the ways I think about this is I think back to where we were in September, October, November of 2020. There was no COVID vaccine, right? And everybody was masking. We were doing great about washing our hands. We were social distancing, all of these things, which certainly helped to prevent the spread of COVID, but also can really help to prevent the spread of flu. And, many people were working from home as they were able to. Now we're in a different place. Thank goodness now many, many folks in the Connecticut community are vaccinated against COVID. But I think that one of the sort of other effects of that is that folks may have become a little more lax with respect to the washing of hands. And I see, as I move around, there are places where folks are great about having a mask that covers their nose and covers their chin as well. But then other places where folks might not be as sort of religious about wearing their mask properly. So, these are all things that are going to set us up for flu to spread from person to person in this year. So I do expect to see higher numbers of flu in this coming season, simply because now we have a little more protection against COVID and people are not as, not as regular about the hand washing and other things. So I think this is one reason why, in my mind, it's so important for people to get the flu vaccine this year, even though we didn't see so much flu in the community last year. I still think it's very important, as well as continuing these precautions, the hand washing, the mask wearing, and things like that.
Can I piggyback onto that?
I was just about to come to you, Leslie, but go right ahead.
The pediatric viewpoint on this is that we view flu as spread primarily through school-age children. So it goes through kids in daycares, nursery schools, and in the primary and secondary schools primarily. And so, as Tracy mentioned, we didn't see as much last year, but what else was going on last year is that kids were primarily doing remote learning and learning from home. And this year they're back in school. So we do anticipate that the flu will start to circulate at close to previous levels. I think it'll be a little bit better with the mask mandates, but they only go so far. You know, kids do drink and eat in schools, and they sneeze and they sit on school buses. So we're very likely to see it.
Wow. I was just about to come to you, but I'm glad you just jumped right in there, because I was just about to ask about the babies. There's been so much in the news with parents being upset about their kids being forced to wear masks in the schools. And just come back a little bit more. How do you help parents, Leslie, to really understand the importance of why their children have to wear masks? Just kind of with some of the things you already said, but is there anything else that you can share with these parents out there to help them understand your kids got to wear masks for this reason and this is why it's important?
You know, it's a funny thing. My patients have been awesome about having their children wear masks. So I have not been put in the hot seat in the exam room. However, in my community where I live personally, I see signs on lawn signs, unmask our kids. It's become, I feel, almost politicized and more about personal choice and personal freedom than it is about protecting their children, protecting their own families, and protecting the community. But to answer the question, until all children are eligible for that vaccine, then the only way that besides, creating an immune bubble of a vaccinated community around those kids, then the next layer of protection is masking. The virus is spread on respiratory droplets. If you can't project a respiratory droplet onto somebody else, then you can't spread the virus as easily. And there's just no other way around it.
There it is. Ahmad, I'm just curious. You saying you're working directly in the hospital majority of the time. Kind of what are you seeing happening, especially with the Delta variant and now coming into the flu? Kind of what's happening actually in the hospitals right now?
Yeah, that's a good question. So I think, kinetic. So I guess I'll start by saying that, I work mostly in the hospital. I work mostly at night. So a lot of the times when I see patients, they're like coming into the hospital, because they're all of a sudden sick for whatever reason. So I'm like one of the first people next to the emergency medicine doctors to see these patients. And so, I think one of the nice things is that, considering, the whole country, Connecticut's in a very good place as far as, COVID vaccination rates. And I think we're among, the top, I'm going to say top 10 states, maybe even top 5 states to have some of the highest vaccination rates, which is great. Doesn't mean we don't have any work to do. We still have a lot of work to do. But, we're doing pretty good as far as vaccination rates. And I think, that has translated into what we're seeing at the hospital. So, at the beginning when we were starting to vaccinate folks in March, April, et cetera, that first sort of big spike of vaccinations, you started seeing how the vaccine affected the people that came into the hospital. So started seeing less elderly folks come into the hospital since they were among the first groups to be vaccinated earlier in the year. Started seeing more young people in the hospital who were sick. And then now as more and more people became vaccinated, you start seeing, a lot of people come in who are sick who aren't vaccinated. And, to be honest, you're seeing there's a lot less COVID that's coming into the hospital, which is good because, the hospital is still a very busy place. And, before COVID, we were taking care of people who had a lot of different other diseases and people who had chronic things going on. And, so hospitals a sort of an infrastructure that never sleeps. So that's good that, the sort of COVID rates went down. But you are still seeing, the smidge of COVID that you're seeing here and there and people coming into the hospital, you're still seeing two groups, right? You're seeing people who aren't vaccinated and, more often than not, those people do come in sicker. And then you do see the people who are vaccinated who don't come in as sick. I mean, I've it's interesting. In the last probably month or so, I've only seen maybe a handful of people, or I've only taken care of a handful of people, when I've been on service. And, it's interesting to see the difference, in how sick people are when they're not vaccinated, having a lot of shortness of breath, needing a lot of oxygen, very distressing for these patients, to seeing like people who are vaccinated coming in and sort of just feeling better. I will say I did see a couple of folks who came in. They're like, wow, I didn't really know I had COVID. I just, I was vaccinated. I didn't feel anything, didn't feel any symptoms, or maybe had a few sniffles. Um, you know, and they're sort of very laid back about it because they don't feel anything. And so you can actually see the difference in people who are vaccinated versus people who are not vaccinated in the hospital. Granted, we still in the hospital, we still split these people up. So people who are positive for COVID, we try to put them in the same units so that way we can kind of protect other people in the hospital and other units who are not COVID units or people who are not positive for COVID. We're still doing that. But I'm happy to say that the rates have gone down, and you can see an appreciable difference in these two groups of people.
But funny thing that I'm listening to a lot of things that you're saying, Ahmed, and I just want to ask this quick question before I go over to Mr. Williams. A lot of people are afraid to go to the hospital because they're afraid that they're going to go in the hospital and get sicker. Kind of what are the precautions and steps that you all are taking to ensure that that doesn't happen?
Right. No, that's a very good question. And, to sort of add to what you're saying, the hospital's been busy with just people coming in for other things. And, as the hospital moves and sort of people move from one area of the hospital to another, move to a room or a bed, those questions come up. If they spend a while in the emergency department, they ask, what's my risk of getting COVID here? And so, you can never say that it's a 0% risk, right? The things that the hospital's doing to take care of that or to reduce that or mitigate the risk is, for one, all healthcare providers are essentially wearing masks. So, I'm wearing a mask all the time. Some of my colleagues double up as far as masks, wearing an N95 on top of a regular mask. That's one big thing. I think one of the most effective things that we do that, it's mostly, sort of hospital policy and also what the emergency medicine folks do is that they test everyone, right? Even if you come in for like a stub toe, or a small skin infection, you get tested, you get swabbed for COVID, and you get asked, have you been exposed? Do you have any breathing symptoms? So then that way we can do one of the most effective things, which is, cohorting, which is essentially sorting people and making sure that, those who test positive or those who we suspect are positive or might have COVID are in their own room, are separated from everyone else. And when the nurses or healthcare providers or anyone comes into that room, we're still fully gowned up, wearing masks, wearing N95s, wearing gowns, and everyone's washing their hands. So a lot of the things that we're doing in the hospital to sort of mitigate the risks, and I won't go into the other technical stuff like negative pressure rooms and whatnot. That's sort of more when people come into the hospital, that we make sure that they're in rooms that are ventilated adequately. But a lot of the measures, when you think about it, it's masking, it's gowning up, right? It's isolating, it's washing your hands. It's really a lot of things that we're doing in the hospital is a lot of the things that we as a sort of medical public health community in general in this country, we're asking people to do at home, because those are some of the things that are the most effective things in reducing the way this virus moves, right? We can't I know this sounds silly, but we can't. None of us can stop breathing, right? None of us can stop. If we have to sneeze, we have to sneeze. You know, if we have to cough, we have to cough. And so none of us can stop the action of, but we can stop the transmission. We can stop the way this thing travels, right? You know, and that's why all those measures, it's the same measures we're doing in the hospital. To the point of masks, you know, a lot of people, one thing I've heard about masks, you know, anecdotally is like a sort of weird kind of myth thing is that, you know, masks don't filter virus, like the regular surgical masks that people wear, it doesn't filter virus, right? You know, and to some extent that's true, right? It's not an N95 mask that's, you know, been designed to help reduce, you know, transmission both in and out. But when you think about it, as we were talking about earlier, when you sneeze, you have these huge droplets that come out of your mouth and your nose. I don't know if you've seen those videos where they show the side profile of people sneezing, droplets just fly everywhere. You know, when you think about it like that, right? Masks are very effective because they just block all that water that's coming out of our mouths, especially sometimes kids' mouths. I don't work with kids, but you know, when kids sneeze, they're very dramatic about it. You know, it stops all that, right? And that affects the way that we move or transmit from our mouths out there. So when people say, you know, I'm wearing a mask to protect you, that's really what we mean. You know, it's, you know, when I sneeze, if I have a mask on, a lot of that droplet stuff is not going to fly out, those water particles with all the gunk that's attached to them, maybe even some virus of flu or rhinovirus or regular common cold. It's not going to all fly out, you know, and that's where the key is. That's where the effect is, you know.
Thank you. Thank you, Mr. Williams. You mentioned that you know kind of what you do for a living with gathering so much information and research. Where are we in that area? What can you tell our public the importance of things they should know as it involves the research and why it just reiterates the importance of getting vaccinated?
Well, like was said earlier, that we have to keep in mind, especially with clinical trials and clinical research right here in our own backyard, right here at Yale. These medicines have been tested amongst our people. Right now, they're testing the trial for the younger kids from, I think, 6 months to 12 years old. That's happening right here in your own backyard. You should be privileged to know that that type of research is happening right in your own community. So the information that's based on that, we have opportunity to look at. I think this is the most important part for us to keep in mind is, if you really believe that your health is your number one wealth, you'll put the same investment into learning about the things that are related to health, the same way you would do if you made a business venture, the same way you would do for the entertainment that we do in our communities on a regular basis. People have to want this knowledge and want this information. It is here for us. And we have an opportunity to see the results of those studies. All this is public information. We can go on the CDC's website and see all of the information that's been going on in reference to the viruses and all of the medical facts that go along with that. But once again, we have to find out and keep having these conversations so that we excite people to want to go after this information. It's there for us. So it's not that this is hidden. It's not something that they kept from us. I think one of the most important things that we saw was even when the Johnson & Johnson and there was some adverse effect, they stopped. They made sure that they showed you what the numbers were. That shows transparency. It was only 6 or 7 people. They could have kind of kept that under the rug and didn't say anything, but they were trying to be, you know, transparent and repair things that has happened over the course of years historically with trust of government and medicine. So these are the reasons why individuals who may have hesitancy can look to these examples and say, they're being straightforward with us. They want us to know these numbers. They want us to know the importance of getting vaccinated. It was brought out, Dr. Rabin, which was true. It was so crazy how us wearing the mask last year really helped flus to be down. And that's something now that we can actually learn from and continue to practice, because we know those droplets do come out of your nose and your mouth. And now if you have a mask on, that stays protected to yourself. And I think that's the thing that kind of bothers me the most, is everyone who's trying to make a decision, the decision you're basing it on yourself. Make the decision based on your family, your friends, and your community. Because when you think in that way, you don't think in a selfish way that it's about me. Yes, you have the freedom to make that choice, but let your choice be based on wanting to help your family, friends, and your local community stay safe and healthy. And when you look at it from that angle, we all take the accountability of finding out the information, making sure it's proper information, make sure it's from a trusted medical source. Sit down with your family, whether it's by hand, take a prayer, or however your beliefs are, and really pray to say that I want the understanding of how I can help my community and help me and my family be safe. And currently, however we look at it, the vaccines are the best way to keep you protected. And once again, we've heard it so many times, it does not stop you from getting COVID. And as Ahmad mentioned, there's individuals, you can see the difference when someone comes in the hospital that was vaccinated and when someone comes in the hospital that's not vaccinated. They are much sicker and they are in a worse position. So if we have this opportunity to get this knowledge and get this research information, let's look at that and have the same interest as any other interest we would have, because this is the most important thing. If you don't have good health, you have nothing. Money or anything doesn't mean anything if you don't have good health. And so this is an opportunity that we are having to take the time to be more personal about our health. People have been missing checkups since COVID and all that. So we want to get back to people understanding, get your health checked out and find out from the medical staff what you need to stay healthy. And I just think that information is the best information that we all can utilize, because we don't only save our lives, but we help to protect the lives of friends, family, and our community.
Oh, thank you. Dr. Seward and Dr. Raymond, I'm just curious about this. I'm hearing that it's okay for people to receive the flu vaccine and the COVID vaccine at the same time. Why, first of all, why is that important that they actually get vaccinated? But then the second piece is letting them know why it's okay to actually get both vaccines at the same time.
Yeah, in the very, very beginning of the pandemic, or at least the vaccination phase of the pandemic, they wanted to hold off on making a recommendation on that until they had sufficient information. But now there is clear evidence that getting the vaccine at the same time as any other vaccine is not a problem. It generates the same immunity and is perfectly safe to get the COVID vaccination along with any other vaccination. And in pediatrics, as anybody remembers taking their babies to the pediatrician at vaccination time, you got a couple jabs all at the same time, couple in this leg, couple on that leg. So we've been doing this for a very long time and not seeing any problems with increased side effects or less effectiveness of those vaccines. And it turns out that it's the same with the COVID vaccine. And so for just a matter of convenience, get them done at the same time. Go get your flu shot. You can get your shingles shot. You can get your pneumonia shot, and you can get your COVID shot all at the same time.
Mm-hmm. Anything you'd like to add to that, Doc?
Well, I was just going to say, I mean, I 100% agree with everything that Leslie just said. I think, as Mr. Williams was saying, people have been hesitant to come in and just take care of routine health things during this period of time. And we understand that because everybody, was restricting their movements and wanting to try to keep themselves safe. Ahmed has talked a little bit about what we're doing as healthcare providers to try to make sure that the clinics and the hospitals are safe, that the places where we're taking care of you are safe for you to come in and get whatever it is that you need done, whether it's checking your blood pressure, whether it's talking about your diabetes, talking about your asthma or your COPD, whatever the issue is. We're trying to make sure that our spaces are safe. We're vaccinating our workforce. We are required to be vaccinated in order to be working. And so I think, from the standpoint of a patient, thinking about wanting to be efficient with your time and sort of keep things moving, I have been recommending to people, let's just get that COVID shot, get the flu shot, get them both done at the same time. Then you don't have to worry about, well, can I make an appointment to come back for this other one? And then, you're going to have to come back for, a second shot. If you get Pfizer or Moderna as your COVID shot, you're going to have to come back for that second shot anyway. So let's just try to streamline things and be as efficient as we can.
Exactly. Jackie, real quickly, you kind of boots on the ground. If anybody would actually receive information, looking for information, kind of what are the areas of town that you're actually in so people can actually find you?
So I'm on Dixon Avenue, Edgewood Park, and downtown New Haven at the Upper Green.
Thank you. It's so funny. We get on these shows and the time just goes swoop. I'm thinking I got all the time in the day, but you don't. We're getting kind of close to that time. So I just want to just leave and leave you all with just leaving remarks to this public that you feel is important for them to know as it relates to getting the flu vaccine and actually continuing to be vaccinated for COVID and this new Delta variant and whatever variant comes up from here and there. And I'll start with Leslie, and then I'll just go down and take a couple of minutes and just kind of give us your concluding statements.
Well, my concluding statement would be to welcome anybody who has questions to please contact us, and to understand that other than the satisfaction of providing very good healthcare, doctors don't have any other agenda. I think some people don't trust us. They might think that we work for the government or that we make more money if we give a vaccine, and that's not true. Our payment is in our patients' good health.
Dr. Raven?
Yeah, absolutely. I mean, I would echo that and just say, I would much rather have somebody who is questioning whether they want to get the vaccine. I'd much rather have you come in and talk to me, talk to one of my colleagues, ask us the questions that you have. If there is a healthcare professional in your life, doesn't have to be a physician, could be, many different types of folks working and providing care for people. But ask somebody who's a professional their opinion. We want to hear your questions. We want to get you the right information. And, it's not a matter of, can we convince you in this visit to get the vaccine or not? Nobody's keeping score. It's not about that. It's about making sure that people get their questions answered, have access to information that is correct. So we just want to talk to you. We want to hear what you have to say.
I agree with that. Dr. Ahmad? Dr. Ahmad?
Yeah, I mean, so I think the thing that was coming into my mind when hearing everyone else is just, you the public deserve or have the right to have the right information. That is something that everyone deserves. And so, I echo wholeheartedly a bajillion times, everything that, everyone's saying is that please, if you have any questions, or any concerns or anything, just, come and talk to folks who work on this on a day-to-day basis from many different avenues, from the research side, from the advocacy side, from, the medical side, folks who just see this stuff every day in different ways. Come and ask us questions about it, because the community deserves to have the right information so that you can make your decision. The other thing I wanted to emphasize is that we are a community, right? You don't see me every day. Maybe the people who watch this have never seen me before, or maybe you saw me one time at one night when I took care of your stubbed toe. But we are a community, right? And there's things that we do to treat one person, but there are so many things that we can do to protect the health of everyone. Even the people we haven't met, right? I've gotten vaccinated to protect those around me, but there is a contribution to that greater community, that greater good. And so, in times like these where we have pandemics and we have things affecting our global health, our security health, our community health. Everything we do as a community matters a lot, matters so much. And so, let's synergize, let's work together, let's keep talking, let's do what we need to do to protect each other. So just remember that it's us, us versus the virus. It's not I versus the virus, so.
Thank you. And Miss Jackie?
I would just like to say that whenever the elderly senior citizens come to pop-up clinics or to the doctor and they have questions, that it be explained in a way that they could understand, not in medical terms, you may talk to your colleagues about, but they really need to hear it in a more simple kind of way, if you will, so they can get their understanding and make the right decision on getting the vaccine.
Thank you. Mr. Williams, take us out. What was your parting concluding messages to take us off the call?
As everyone said, get the proper information, take the time, and enjoy learning the knowledge that will help you to protect you, your family, and your community. And we are, as Ahmad said it the best, this is us versus the virus, not I versus the virus.
I want to thank all of you for taking the time out to come on the call today. What you shared, I hope the community takes in and know that it's actual factual information, not to hurt them, but to assist them and make us a healthier community. I thank Tom Ficklin at 103.5 WNHH Community Radio for taking the time out to allow us to come and share. You all be great. Continue the work that you do. I respect you so much. I thank you for the time that you've given me today. And this community is so much better because of you. You all have a wonderful afternoon. I send the love to you from my heart to yours. Y'all take care.
Thank you.
As I got another rhyme, another rhythm for y'all to listen. I'm never quitting on my mission. I'ma roll with what I'm giving. Got some ambition, this new edition, filling positions. Looking at the void in myself and feeling what's missing. Better watch the way you going, better go in the right direction. In the moment you stressing, but you gon' be counting blessings. And I know that for certain. Keep on working, open curtains, haters swerving, cause they ain't ready for your final version. Whoa. I'm never gonna give up.
This is Harry Drills, and you're listening to WNHHLP 103.5 FM, New Haven.
Fall down, I just gotta get up, hey. Yeah, this is my road. Lights, camera, action, I'm ready to go. I said from night to dawn, I right my wrongs alone. In competition with warnings, ice galore. Now I'm running toward them highlights, I'm finished being